Welcome to our channel. Today we are diving into a topic that is affecting many people around the world. That is dysmenorrhea, commonly called painful menses or painful cramps. If you are one of the many people who are experiencing intense menstruation pain, you know how intense it can interfere with your daily life. In this video, we will cover everything from the basics to more advanced treatment option that you can get. So let's get started. First, let's talk about what painful menses really means. Dysmenorrhea is a medical term for pain associated with menstruation. It can range from mild discomfort to severe pain that interfere with daily activities. There are two types of dysmenorrhea: primary and secondary dysmenorrhea. Primary dysmenorrhea is the most common type and usually begin with a patient's first period, which we call menarche, or within a few years after the menarche. It is characterized by the pain that is typically starts just before or at the onset of menstruation and lasts for 1 to 3 days. In general, primary dysmenorrhea becomes less painful with age. The risk of dysmenorrhea is increased for those that get a period start before age of 11, and they are heavier or longer period experience with stress level or people who are smoking. The pain is caused by uterine contraction triggered by what we call prostaglandin, which is a hormone-like substances that is in your body. And this chemical prostaglandin, it makes the uterus to contract. That will help the uterus to shed its lining. That shedding of the lining, that's what we call menses. So high level of prostaglandin can cause more intense contraction, which will lead to the pain that you are having. Secondary dysmenorrhea, on the other hand, is caused by underlying medical condition. This type of pain often begins earlier in the menses and lasts longer than the primary dysmenorrhea. In this case, the pain tends to be more severe and may worsen with the age. And health conditions that may trigger this secondary amenorrhea are many. We can include the following: ovarian cysts, uterine fibroids, endometriosis, adenomyosis, copper IUCD, intrauterine device that you can place in your womb for contraception, pelvic inflammatory disease, and uterine defects. All these can create pain during your menses. So what is the prevalence and impact? According to the American College of Obstetrician Gynecologist, over half of women who menstruate report some kind of pain for 1 or 2 days each month. In fact, some statistics show that is more than 95% of the individual. They have some kind of pain during the menstruation. However, 5 and 10% of these women will have severe pain that will interfere with their daily activities and even missing school or missing work. So how can you tell if your period pain is normal or something is worse or serious? Common symptoms of dysmenorrhea include usually cramping in the lower abdominal pain that radiate in the lower back or irradiate on your thigh, and sometimes nausea, vomiting or diarrhea, sometimes headaches, and sometimes fatigue. If your symptoms are severe or if you experience pain at time other than your period, it is good to go and consult a healthcare provider, because there he will diagnose dysmenorrhea. And how does he diagnose it? To diagnose dysmenorrhea, healthcare provider may perform a physical exam. He will review your medical history, and sometimes he will recommend some imaging tests like ultrasound scan. What are the treatment options? Let's talk about what you can do to manage painful period. The good news is that there are several treatment options available. Treatment for dysmenorrhea vary depending on the severity and the underlying cause, like we've just given them. But the common treatment is usually the over-the-counter pain reliever or painkillers like brufen, or sometimes they can give you hormonal contraceptive or heat therapy, or lifestyle changes like regular exercises and a healthy diet. It can help to alleviate those pain. But many find relief also through home remedies like heating pad on the lower abdomen, drinking herbal teas like a chamomile tea or ginger tea, or practicing some techniques, some exercises that can help you. If the messes continue, however, persistent, or it is accompanied by other symptoms like heavy bleeding and prolonged period, it is important to consult your healthcare provider, because there they can help you to demarcate the cause, and then they will give you appropriate treatment that is related to the cause. And sometimes the doctor might recommend that you get surgery like for them if you have fibroid or if you have endometriosis. Thank you for watching. We hope this video has given you a better understanding of painful period and how you can manage it. Remember, if you are experiencing painful period, you are not alone, and there are many ways to find pain relief. So if you found this video helpful, don't forget to like it, to share it, to subscribe, and hit the bell icon to stay updated when a new content is coming to the channel. And remember, if you are struggling with severe menstruation, it is important to consult a healthcare provider. If you have questions and comments, drop them in the comment section. Take care, and let's see each other in the next video. God bless.